This is Van Electric Ghost, and we're live on the air with Dr. Victoria Mondloch. And I wanted to let you know that we are a feature podcast on Newsly. You can see that scrolling below. If you haven't checked out that platform, you can use coupon code GHOST and check that out for a month. That is an audio platform, and later will be on there as a featured podcast. But again, thank you for being on the podcast today. And we're going to get into your background. We do have your website up, drvictoriamonloch.com, and that will be fully clickable to anybody who wants to check that out when we're published on all the other platforms that we're on. But first thing we always ask any guest on the show is like, what motivates you and why do you do what you do?
Well, and thank you for allowing me to be a guest on your show. I am actually a retired wellness doctor, OBGYN, and so a lot of people ask me why I'm still active with retirement. And it's that my mission is still my mission, which is to educate and empower not only women, despite me being an OBGYN, I also saw men, but to have men and women reach their optimal health, not just good health, but optimal health. So now that I've retired, I'm not within the constraints of my patient practice. I have a much larger stage and larger audience.
That's cool. So you wanted to continue to like bring it forward and maybe be able to do things that if you were in your position you couldn't do. So yeah, it's always interesting. Sometimes you're kind of forced to be in a lane, and then when you can, get to a position where you're not always, forced to be in that lane, you can look at other things.
Correct. Correct.
So that's awesome. So maybe give a little backdrop in terms of your story and how you got to where you are now. Kind of maybe like an elevator pitch at a brief, but we can dive into it because we got an hour. But I don't know
Sure.
how you want to approach that.
Well, I'm a very unconventional doc. I didn't intend to go to medical school at first. I was going to go in a totally different direction. And it was only when I had a teacher challenge me and tell me that he didn't like the direction I was picking, that he thought I should go a different direction. And I started getting encouragement from other people. I thought, well, I can at least take a dabble at it and do a little science when I'm in college. Well, I ended up liking science so much that I ended up in research first and then ended up getting into medical school. When I got to medical school, I almost quit. And the reason is that I learned very early that medical doctors are very good at saying what they feel is going on, but they're not very good at admitting when they make a mistake. And they're very slow to admit that they made a mistake. So here I was, first year in medical school, and I'm going to class with a fever of 103.5 and peritonitis. So I'm hunched over. I can't even stand up straight. But you don't miss class. This is medical school, right? You suck it up and you just keep going. So I am seeing the school doctor. He brings 5 specialists through to see me. And the 5th doctor says, you have a cyst on your ovary, and I'm going to manually ovulate you. Well, what it was is I kept asking these docs, couldn't this be appendicitis? Oh, no, absolutely not. No way this is appendicitis. Well, the 5th doc, who now does a pelvic exam and feels my appendix abscess, the pocket of infection around my appendix, and he says, I'm going to manually ovulate you. Well, anybody who knows appendicitis knows if you touch your abdomen and let go, you want to reach up and hang onto the ceiling. So I am screaming, and he starts the rupture of this abscess and turns around and walks out and says, there, don't you feel better?
Jeez.
So 15 minutes later, I'm back in class, and it blows. And it feels like somebody put a shotgun to my belly and shot at short range. and I just pass out right on the lecture table.
Wow.
So back up to the doc's office. We've got to admit you. We've got to explore. We've got to figure out what's going on. So that night, as I'm going into shock, the chair of the GYN department is going to be my savior and take me to the operating room. So before he wheels me in, he said, "Do you have any questions?" And my husband was standing right there. And I said, "Yes, I do. Why is my diagnosis a twisted ovarian cyst when I have fever and peritonitis?" I said, the two don't fit. Now, I'm a freshman medical student challenging the chair of the department, right? And literally, he grabs my hand and he goes, now, dear, that's why I'm the staff and you're the student. So they take me to the OR. I die on the operating room table. And they have to bring me back and call in a surgical team who then works through the wrong incision because I'm a medical student. I have to get back to class ASAP. So I wake up from surgery and here's a gentleman sitting at the end of my bed, and he straightens up and, says, "I'm from the medical college." And I said, "Oh, wasn't that nice that you're here to check on me?" And he goes, "I'm here to tell you, you missed your exams and you have to get your butt back to class because you are considered incomplete and you may be kicked out of school." And here I am, NG tube in place, dual IVs. I'm just waking up from surgery. I still have the original dressing on. They haven't even taken that off. So I am literally back in class 9 days later because I had to be.
That's crazy. I mean,
Well,
is that just the insensitivity of not understanding, women as these male doctors?
I'll get to that. I'll get to that. So I almost quit medical school, and I decided, no, be the change agent. Be the person who makes the difference. So I stayed, finished medical school, got into my residency, finished my residency. I'm now a full-fledged MD. I am working at a job, and I'm an OBGYN. 2 days before I'm delivering my second daughter, I go into a bowel obstruction, which is scar tissue, which has kinked my bowel, and nothing can go forward. Everything is coming backwards, and I'm cramping like no tomorrow. And I'm thinking I'm in labor because I'm 2 days from my due date. And no, it's a bowel obstruction. So long story short, we get my daughter delivered, and the bowel obstruction does not go away. I'm on morphine every 2 hours for the pain. And the surgeon who is seeing me doesn't believe that I'm in pain. So he sends the nurse in with a sleeping pill, which anybody who knows that if you have a tube going down into your stomach to suck out contents to keep your GI tract quiet, you don't give them a pill. You're not even supposed to have ice chips, right? So the nurse comes in with my pill and she said, "Well, the surgeon wants to see if your pain is real." I said, "What? What? This is doctor to doctor. This isn't even just student to staff. This is doctor to doctor." So the next day, he comes in to see me. I have fever and I'm developing peritonitis again. And he goes, "Well, we have to operate." And I said, "Well, you think?" So the chief resident, because this is the hospital I trained at, the chief resident comes in and he said, "Can I be in on your surgery?" And I said, "You have to be. You are my eyes and ears, because the surgeon isn't going to tell me the truth of what he finds." Now, what a sad state to say that, right? So they take me to the operating room and he opens me up. And this is now the chief resident telling me this after I come to. He said, "Your bowel was black." He touched it and it went poof. And you went flatline and you died on the table. So I've died twice on the table. Both times because the surgeon didn't believe that my pain was real.
Was real. Yeah, that's really bad. I mean, but
Well,
being
it's
in my,
bad,
yeah, I mean,
right?
what's really tragic, it's unbelievable, but it's not so unbelievable because, like, if you've read, like, there's a lot of information nowadays about how women are treated and how, like, minorities have been treated by doctors, where they don't listen. With African Americans, they think we have very high pain tolerance, the same kind of parallels. So they actually don't listen to what you tell them, and then they make
Correct.
assumptions, and they just have these mind points of view that are so narrow and so kind of backward. It's like, shouldn't you have a more inquisitive mind, a more thoughtful, holistic approach than to be so like tunnel vision?
Not well, right. And not only that, is it because I was a woman? Perhaps. But this is MD to MD. So how is he going to treat the regular patient?
Anybody else?
Oh
Yeah.
my, right. To discount
Insensitivity and not listening. It's like they're not
exactly.
listening. You're giving them. You're a doctor. You're telling them information, and for whatever reason, whether it's like sexism or just ignorance or something else, they're not actually processing the reality. And it's like, why are they seeing something different than what you're seeing or what you feel? And
Right.
that's like, not it's like, why you get dumbfounded, like, why is that?
Right. And so, is it the woman thing? Is it a race thing? Is it truly that that African Americans and Mexican Americans are treated differently? We see examples all over the place of that. There are, the Mexican American community, because there is a language difference with many of those patient physician relationships, that women in labor were actually told if they weren't progressing, rather than bring in an interpreter and discuss that, oh, we'll start something where we'll try Pitocin or we'll try an epidural. They would literally come in and say, well, we just need to do surgery. Your baby is in distress and we just need to do surgery. And they would never even try and explain that there were other options that could be tried because it was too much work.
Too much work
Now,
to actually communicate.
right, right. And now we had to chart that. And oh my goodness, that might make us late getting off shift. And you can say, oh, you're just making that up. But I know for a fact that those types of instances occurred. So this is real, and it is a very expensive venture to seek healthcare. And yet we pay all of this monetary for healthcare, and we get the kind of service that we get. And there would be no other service that you would pay that amount of money for and actually accept the
Bad
outcome
outcomes.
of what you get.
Bad outcomes.
Right. You
Yeah,
you wouldn't accept
it's
it.
just because
You
this.
would,
Well, I think it's
yeah.
it might be because there's a PhD. Not to put it down, but I think sometimes it's like this ivory tower. Like, if you're at this level, then you think you're beyond question. Like you're saying, they don't want to admit mistakes, and so, and then they get like a mindset that makes them, not willing. Like in other professions, you're kind of measured by your errors. Like, I'm in IT, I'm in
Mm-hmm.
software design. If we don't put out good quality, we have quality metrics that look at what we're putting out, and we get judged by the quality of the stuff we put out. But it
Mm-hmm.
looks like what you're saying is they're not being judged by the quality of what they do.
It's crazy. It's just crazy. So I literally had been the president of my 8th physician OBGYN group, and I wanted wellness to come into the office, and the other 7 didn't. So I literally
Hmm.
quit my job. I quit and I went out solo because I said, you can't accept wellness? Well, what is it that you will accept. Well, we want more surgeries. We want more procedures. We want to make more money. And I said, you guys make enough money. What is your problem? Well, there's never enough money. I said, I can't work with you. If you cannot accept that wellness is something that patients deserve, then I quit. And I literally quit my job and I went solo. And my practice, since going solo for the past 20 years before I retired last year, was all about how do I reach not just good health with my patients, how do I reach optimal health? And you may say, well, that's just a little bit over good health. Well, no. I'm going to beg to differ, because I'm going to say to you, the way the medical profession works is that you get a blood test drawn and they'll say to you, it's in normal range. You are within the normal range. All is good. What I say is that's the normal range determined by labs from a 12-year-old to a 90-year-old. Most people have no idea that that's what the reference range is based on. Okay. So I say, I want to know where you need to be for optimal health. And optimal means that you are also so healthy, you are preventing this.
Oh, so you're thinking about the long term. You got a more holistic point of view.
I do. So realize optimal health says, I want to keep you forever 15 to 20 years younger than your stated age.
That's a different metric. That's a different analysis of the numbers, right? So if you're looking at that number,
right.
You're looking at a different, you're trying to put it into a band and maybe say, in this band, are you actually optimal for maybe other characteristics, and actually putting more data, doing more assessments.
Then I also said, not only do I want optimal, but I want to do the foundation of your health, which is the 4 basic hormone groups. And those 4 hormone groups, guess what? They're not checked by traditional Western medicine. Wow. Why not? They don't even teach it in medical school. What? Now I will.
So there's more Eastern concepts than Western. Are those more Eastern?
It's a blend. It's a blend, because what I'll tell you is that every single patient that I told them I was going to check their 4 hormone groups, they look at me and say, well, doc, I want my insurance to cover this. And I'd say, it will. These are all labs. A traditional lab will draw. They're codable with ICD-10 codes, and your insurance will pay for them. They're like, let's go. So when you check those 4 hormone groups, I want you to think of them like 4 legs of a chair. And if you sit on a chair with a broken leg, what happens? Yeah. Boom, you're on the floor.
You're going to be out of balance.
Right? You're on the floor. So you dutifully rewrite that chair. You may ask your doctor, well, what's wrong? Well, they do their set of labs and they go, everything looks good here. I don't know what's wrong. Get out of my office. So you go back home and you sit on that same chair with a broken leg. Boom. Well, isn't that the definition of insanity? You keep doing the same thing and expecting a different result. So
a lot of times people don't feel good. Yeah, but like a lot of times people don't feel good, and then they go to the doctor, and based on what you're saying, because they don't dive deep enough, they don't find it, and then because they don't find
root cause. Yeah, there's no looking for the root cause of why. So I always told my patients, not only am I the incessant 2-year-old, but I want you to be the incessant 2-year-old. Why do I feel this way? Why is this happening? And it's my job to rebalance those 4 hormone groups. And I don't want them just in reference range. Remember, I want them in optimal range.
Yeah.
Right.
There's a different number.
Because that's going to be, okay, we're going to roll up our sleeves now. Because if you want optimal health with me, then we're going to tune you so well that you're going to have the energy back that you thought you lost forever. You're going to sleep well. You're going to be able to do pretty much what you want to do, and you're going to feel good. You're going to prevent cancer. Whoa, I'm going to start to get you off of some of the medication that you're on. What? In other words, if your body can literally act 15 to 20 years younger than your age, put yourself back there and say, that's how I used to feel. I'd have patients say to me, oh, Doc, I've got my moxie back. Wow. And it's not hard. It's simply using an optimal reference range that's age appropriate for you and balancing those 4 hormone groups. And guess what? It's all covered by your insurance.
Could it be that modern medicine is more reactive than proactive, and because the way you're talking about how the profit structure is, it's actually better to be reactive than proactive? Because I had talked to a psychologist one time, and they said, well, if I actually do what I really should do, my patient is probably not going to need to see me, and they're not going to be on the meds, which then they're not billable. So if they're not billable, then I'm not going to make any money. So is this the same kind of concept?
It is. Now realize that before 1990, most physicians were independent. So they practiced that way. If they were ethical, that's the way they practiced. Because doctors are here, we take an oath, do no harm. We are here to help. Okay. So since 1990, hospitals and insurance companies have been employing physicians. You know that 77% of all physicians are employed physicians by hospitals or healthcare insurance companies
or
or
private practice anymore. They're not private. They're actually part of some corporation.
Right. So they're not the ones making the decisions. The CEO of that organization tells them per quota how many referrals you have to make for this, for that, how many procedures. And if you don't make quota, you are actually going to get docked in pay. If you do it again, you're going to get docked in vacation. If you do it again, you're going to get fired.
Well, that's not very, that's not actually going to be in the interest of creating healthy people. It's in the interest of like corporate profit.
Right. The expectations of the patient no longer are the expectations of the system. They are at exact opposites of each other. So
it kind of makes it say, like, is the for-profit model ever going to work ethically? You know, if you can't do the Hippocratic Oath, if you're really, supporting a actuarial Wall Street profit model, how is that ever going to match to like optimum health?
Well, you're right, but the answer is that we rely on a pharmaceutical chemical model of treatment. Is our body natural? Yes, we have chemical reactions, but do we take unnatural chemicals and dump them in our body? Well, there's lots of examples of how we do that. Okay. Even soda. I'll just pick on soda. I'll pick on cigarettes. There are many things that we choose to do, but when we're told by a healthcare provider, I'm going to help you with your thyroid issue, here is this chemical. Well, now you really are trusting that they know best when it's a pharmaceutical chemical model that may not be the best treatment for your body, which is a symphony of multiple systems working together with those 4 hormone groups as your base. They're all talking to each other. So what happens if you put a medication in? It works on one leg over here and the other 3 are going, what about
Adverse
us?
reaction. Well, you get all
Yeah,
the side
how
effects,
do I
you know.
interact with that? And so
Yeah.
it just doesn't always work the way we want it to work. So again, when you balance those 4 hormone groups, I could get people off of medication. I could actually get them so healthy that all they needed was supplements.
Yeah. Is it more organic? Like you're talking about more naturopathic, organic, and maybe through diet and maybe
Well,
not just diet, but other things that maybe aren't as chemical, but more like, you know,
there
imbalanced.
are there are many things that patients can do with lifestyle. So yes, diet, exercise, and it's not just that I tell you, oh my gosh, go home and exercise. You need to do 10,000 steps. What I'm going to tell you, because you're going to look at me and go, well, I've got a crazy busy life, doc. I do 3 jobs. I've got 5 kids. I don't have time to 10,000 steps every day. Well, I'm going to give you this practical bit of advice and say, if you do 5 minutes of stair walking, it's equal to 30 minutes of walking continuously in a flat surface.
Mm-hmm.
Wow. Now, that was just useful information that you could now turn into your busy lifestyle and make it work. Everybody's got 5 minutes.
Yeah. Yeah. I mean, you can integrate things like that. Because like if you're like I'm in IT and I have a stand-up desk and I have a
Mm-hmm,
stepper and I have like a treadmill type of thing. So while I'm working, I'm standing at it right now instead of sitting. I
mm-hmm,
can step and I actually check my steps. I do like tons of steps
mm-hmm.
because I have a stand up desk. I tend to move around, and then even when I sit down, I have the thing. So if you integrate that into your daily life, and you say, "Well, I don't have time," because you're thinking you got to go outside to do it, but you know you can still go for a walk. But if you find ways to integrate things and it really,
Bingo.
I'm a diabetic, and I've been able to control my diabetes because I actually move a lot more, and they
Mm-hmm.
change, update my diet too. But there's a lot of things like you can do without meds if you can, and then
Right.
it's not impossible to actually integrate it into your life.
Right, right. And so, what I even tell people as they are pre diabetic or even early diabetic is if you can do enough aerobic exercise and you can actually get not only adequate fluid in you a day, which, oh my gosh, what is adequate fluid? Okay. But that if you can do your 3 meals, no snacks for the most part, most diabetics have to have a snack before bedtime, but
Hmm.
most even pre diabetics, they've never had their insulin level checked, which is one of those 4 legs of a chair. So I'm going to
Hmm.
bet that you never had an insulin level checked before they told you you were diabetic.
No, I never had it checked until I was like 28. I mean, I had cancer, and I never had diabetes before cancer, but maybe I did. And I had a level 3 sarcoma, and then I'm 56 now. I survived it, but like right after all the chemo and radiation, they tested me. I'm like, oh, you're diabetic. So I don't know if it was like all the trauma or it was actually really there and they didn't see it, but because they were doing all that
Hard to
blood work,
say.
they found it.
Right. Hard to say, but the point is could that, if it was something predisposing, could it have been found earlier by checking insulin levels and reversing it? That's my whole point is, and I'm sorry that happened to you because maybe the chemo damaged your pancreas and kicked you into diabetes as well. But the point is that we
Yeah, that's what
don't
I'm
look,
thinking.
yeah, we don't look to prevent things. We look for when the disease is there. We do nothing to prevent. And that's insulin is one example. You can head off prediabetes and insulin resistance for years before it ever turns to diabetes. But nobody
Hmm.
looks because they don't make
Yeah.
money if they prevent it in you. They make a
Yeah,
lot of
when they make a
money.
lot of money by prescribing all the meds, and all the
Exactly.
stuff that, and then they spend so much time on the cancer, they probably didn't think about like, oh, like that's not their top concern. They keep me from becoming a diabetic because the chemo does damage to my pancreas. That wasn't their primary concern. They weren't even, they were just trying to get rid of the sarcoma. So like, I understand that. That's an oncologist. That's what they're going to do. But, it's kind of like they're not looking at everything.
They look at their little silo, their world, and the rest of it we'll deal with later. It's like, wait a minute. My whole body is still my whole body. I leave your office and I still have to deal with the rest of my body.
Body,
So
yeah.
you only deal with my little part when I'm in your office, but I have the rest of my body to deal with. Mm-hmm. Yep.
It's like that
So,
specialization. You wonder that are they talking to each other? Like if you go to
no.
these specialists, they don't seem to have any kind of crosstalk to actually see the whole person, like the whole body. It's like they're so focused on their narrow area that they don't
Mm-hmm.
think about the consequences. Like, if you do something things can be exponential. We do something in code that affects, the stuff that's coming in, the stuff that's coming out. So I can see patterns, and if I don't focus, I can wreck something. And so
Right.
systems like computer systems, not as complex as the body, but I can cause something to have an unexpected impact if I don't look at the big picture. If I just stay at my low, I'm only doing this part, but it's part of a whole. And if you don't consider that, like the regression test
Mm-hmm.
to see what happens if you do this, does it break something else? And people tend to not do the regression, which is probably
Right. And
similar to what you're doing. But
right. I'll give you another example is whenever there is a cardiac patient and they see the cardiologist and they want them on a lipid lowering medication where they want their total cholesterol, because, there's the good and the bad cholesterol and the total triglycerides. There's a lot in that lipid panel. But what they'll say to a cardiac patient is, I need your cholesterol below 100.
mm-hmm.
Okay. Now, realize that in the world of medicine, a healthy body needs a cholesterol level of 140 to make hormone.
Oh, so they're telling you to go under.
Right. Because that works in their world, but it throws a wrench in
Harms
lots
the
of
other
other
world.
parts of your
Throws things
body.
off in the, yeah. That's the disconnect I'm talking about. It's like you think this is the right number, but the other systems that's not the right number. But that's not
Correct.
your concern, so you keep on pushing that, and then
Right.
everybody's like gets out of balance, and they're like, "Why are you out of balance?" It's because this guy's saying it's supposed to be X, and it's not X. It's something. It's
Right.
Y, but they won't
Right.
change because they're like, "That's what it is."
This is my world. This is where I want you. So sometimes there's this tussle back and forth, and the poor patient is stuck in the middle. And so I tried to mitigate all of that for my patients. And I said, listen, if I just get you to optimal, we don't have to have those little side discussions. They go away
Mm-hmm.
because you don't need those side discussions anymore. So in the last 20 years of my practice, again, OBGYN, I started with women, but I would, with their consent, follow their hormone levels. And then I developed the graphs of where their hormone levels should be for their age.
Like a
What a
band,
concept,
like you do an age band. Yeah, that's
right?
cool.
What a concept. Well, guess what? That works with men too. What?
That would make sense. It's just probably different levels,
Right.
but based on your sex, and different hormones based on your sex, but the same concept of the banding. But
Right.
it makes a lot of sense to me. Being I deal with a lot of data, and they see parallels and like patterns, and like I can understand even if I'm not a medical professional, I can kind of get into the idea of the data
Right. But
structure.
the concept remains the same. So,
Yeah.
so I started writing books about what that looked like in the real world. And doctors didn't want to read this, but the patients needed to know this information so that they could educate themselves and they could then be empowered to take it to another doctor, maybe they moved, they're in a new city, that they could say, this is the way I was being treated, and this is what I want you to do with me. And here's the book that says why. So my first book was all about the adolescent, the first forgotten female, because everybody knows adolescent with a little hormone imbalance, right? And that hormone imbalance is not understood. What did doctors say? They say, I'm going to put you on the pill. It'll even things out and you'll be fine. Well, I don't want to go on the pill. Well, that's what I have for you. That's it. There's not
that's
even
all they got.
Right.
Yeah, there's nothing else.
So, right. So I tell the truths. I dispel the myths. I go through the research. I talk about the symptoms. I talk about lifestyle. I talk about eating disorders. And it's written as a mother-daughter guide because the mom needs to be a partner with their adolescent, not adversarial with their adolescent. And at the back of each book, there are not only case studies of patients that were in my office that I changed the names, but also a chapter how to talk to your healthcare provider. Wow. So then,
not let them top down you, because I think the problem is, like, if you get, like, a mother goes to the doctor and the doctor says top down, you need to be on birth control, and you don't question it, then you don't look at any other information to know there's another path.
Correct. And you don't even know that there might be another problem going on. What if the migraines and the really heavy bleeding that are going on is really hormone imbalance, and you're not helping anything down the road by simply covering it up with a pill?
Yeah, to cover it up. That's the problem with, like, the Western medicine is, like, the pill tends to, like, really just cover up. It doesn't really get rid of the source problem, right? And then it ends up causing other problems
down the road, like infertility and all sorts of other issues, right? So the second book I wrote was for the adolescent's mom and grandma. So the second forgotten female is the perimenopause, menopause, postmenopause woman. And they get told the disinformation that hormone is bad for you. Well, wait a minute. If hormone is our lifeblood and it's how we get pregnant and deliver babies and have families, why is it so good for us from age 12 to age 50, and then it suddenly flips and it's bad for us?
Bad.
Wait a minute. We're the same body. What changed overnight? Nothing. Except there was bad research, and the difference between American research and European research is actually opposite results doing the same research. And you go, wait a minute. Wait a minute. How can you get opposite results? Well, menopausal research in Europe was done with human-based female hormone, estradiol and progesterone. They came up with no increase in breast cancer, decrease in heart attack, decrease in stroke, decrease in osteoporosis. American research didn't look at human-based. Oh no, we have to be pharmaceutical. So we looked at Premarin, which is pregnant mare's urine. What? Pregnant horse pee?
How would that be equate to humans? Where did they get the idea that was equal? Where did they get the idea that was equal?
Right?
Some biochemist thought it was equal?
No, some pharmaceutical company thought that we can make this, we can control the process, and therefore it's our process. We own it. We get the patent rights or whatever.
It's the capitalist mindset.
Right. And they've had a synthetic chemical progesterone that, guess what? When you actually dive into the side effects of that progesterone, it causes infertility and breast cancer. What?
So is that coincidental, or did they want to have other things to have other services?
Well, I'll let you conjecture on that one. But think about the fact that the American result, the Women's Health Initiative, is still called the gold standard of menopause research in this country, and they looked at pregnant horse pee and chemical progesterone. And
That
it
doesn't even
said,
make any sense.
right. And they said, women, don't take hormone because it causes an increase in breast cancer, increase in heart attack, increase in stroke. And by the way, we'll do it just while you have symptoms, and then we're taking you off because it's bad for you. Hormone causes cancer. And I'm going, whoa, wait a minute. I have 20 years of my own patient research and the graphs that I discovered and the European research over here that says decrease in breast cancer, decrease in heart attack, decrease in stroke, decrease in osteoporosis, and decrease in Alzheimer's.
So they might have been doing something that caused it.
So it's a huge disconnect. It's a huge 180 of what chemical Western pharmaceutical approach versus human-based bioidentical approaches. So I will let, every patient make their own decision.
Is that like the magic bullet theory? Like a lot of times in Western medicine, there's always some kind of magic pill that's going to come in and save the day.
Because it'll make that pharmaceutical company a fortune.
But like you're saying, there's like all these legs in a pillar. You have multiple systems. You have the four hormone areas, and then they get tunnel vision and they do one thing.
Right.
And then that one thing they don't consider, like the regression, which is in your body, it was like, what happens if you do this? What happens to other systems? Don't just look at the system that you're trying to fix. Look at what's the result to other systems in your body. And then they seem to want to ignore that or kind of hide it.
Yeah. And what they'll tell you is that's too complex to do research on. We have to narrow it down to one thing that we really, really drill down and study. Well,
that's not how the body works, right?
Not how the body works. That's exactly right. So my approach with my patients was, I will promise you, you will feel 15 to 20 years younger than your stated age. I will keep you forever age 45. Are you okay with that?
So that's more regenerative rather than, it seems like everything with the Western medicine is kind of reactive, and then you seem to get into the decline. Because if you're not into regeneration, then you just have degradation. So is that really what's going on? Is like you have more of a regenerative process and their process is more degenerative?
I am preventive. I am saying if you keep a body healthy, it's like your car. You don't wait for the axle to break to go, oh, I guess maybe I should have taken it in and had the tires balanced and should have, woulda, could have, right? You do your preventive maintenance on your car because your car is important to you, right? Or better yet, if you're on the side of the road because you've got an engine problem and you call AAA or the tow truck or whatever, and they come out and they go, oh, you just need gas in your engine. Well, no, I filled up right before, so I've got enough gas. Well, we'll top you off, and they top you off, and then see ya, you're good now. Well, no, wait a minute. My problem is the engine. Oh, no, you're good to go. It's like, no, address the problem.
The core problem. They just want to be specialists. It just seems that specialization is like, it doesn't get you anywhere. It might be short term. So there's so many short term quick fix is not the holistic full fix, because like we're saying, the body is interconnected. So, like in society, things are interconnected. But people say, oh, I'm an island. Like, no, there's all this stuff. You're connected to the environment. You're connected to other people. You're connected to the planet, right? So, like, but you think you're not. Like, you say, well, I can be in this island and I'm separate from it. It's like, well, these things are affecting you, but you don't want to believe they are.
Right. So if I have resources that people can actually have on their bookshelf, on their desk, before they go to the doctor, they can actually do their education, their homework, know what they're going to say to their doctor, and go in and say, this is what I want. It's the last chapter in this book. This is what I want you to do for me. Then
to
now
make sure they
you
do
are
the right test.
right, because I tell them what tests you want done. So I am empowering women, and again, the men's book is coming, okay? But I am here to empower people to say, you can take charge of your health and you can prevent many of the cancers in your, in your family. Even if you are BRCA positive, the gene for breast cancer, if you are estrogen dominant and you know that for the 20 years before you ever get a mammogram, guess what? You have a much lower chance of having that BRCA kick in because you've managed the risk factors ahead of time. You can't change
You
your
just need
gene.
to be informed. Yeah, I think a lot of
Right.
people think like medicine is way beyond their pay grade, so they don't want to know the details. Like my pop, he was like that, and he died of Alzheimer's, but he would never, when he went to the doctor, he would never really communicate. His opinion was, well, they're the doctor, they're supposed to tell me what's going on, and my mom would like yell at him and say, you got to tell the doctor what you're feeling. You got to tell it. The
Right.
doctor's not going to magically know, and they won't do tests if you don't tell them what's going on. They're not going to
Right.
automatically know. And if you don't do the extra work to figure out, like, should you do this or should you not do that? Um, it's some homework, like you said. And maybe some people say, "Well, why I didn't go to medical school. I don't know," but like you still can do the research. You can go on Google and look for things, or you talk to somebody like you to try to find out what to
Yep.
do.
And only you live in your body. I can't tell you that your shoulder pain is a mild or a moderate or severe. Only you can tell me that. Okay.
Mm-hmm.
How it interferes with your life. It was always a mystery to me that people would say, oh, well, you've got really bad cramps every month, and you have trouble sleeping, and you feel really bloated after you eat a meal. Well, you must be depressed. Wait a minute. Since when did that suddenly, all those three systems suddenly go to my head and I'm suddenly
Everything's in the
depressed?
head. Everything's in your
You know,
head.
right. It's like, no, listen to me. And part of the
Yeah,
problem is that, at least in the past, doctors would take the time, at least I think some
to
of them,
listen.
to listen. But now only 23% are independent that will listen to you. The other 77% are employed, and they might want to listen to you, but they can't. So that's why I have
Yeah. So
resources in
is that like the importance? I guess the question also, I've noticed, like my wife goes to a like a naturopathic doctor, but we
naturopath.
also have a primary, yeah, but we also have a primary care, but we have another doctor that we're able to kind of go to and get these kind of what you're doing, right? Because
Mm-hmm.
she had some results with the primary care doctor that they seem to be able, they're going on this corporate path, and I want to
Mm.
really know like the other things that are possible. What are the other possible consequences? Not everybody wants to get that second opinion, but I think it's important to actually reach out to people like yourself and not just get the top down from your primary care without like doing what you're saying
Well,
to
right. And
read
I'll
and
give you
figure it
one
out.
really quick example is one of the tests that I would do on a patient was to see if they were missing the gene that would tell their body to clear up junk in their tissues. And the process is called methylation. But 30% of the population is missing one or two of the four main genes that help you do that. Well, that's a
Mm,
lot. That's a big chunk of the population, right? Well, people that can't clear junk out of their muscles, I want you to think about going to the gym and you get that burn, right? When you finish an exercise, you get that lactic acid buildup. Well, what if you never cleared it?
hmm.
What if you could never
Oh
clear
wow! So
that
what happens?
lactic acid and it built and it built and it built? Well, I'm not saying it's lactic acid, but what if other toxins of tissue breakdown
build like that.
never get cleared? Well, those are primarily patients that I saw that were told they had fibromyalgia. Now, when I checked them to see if they were missing one or two of those genes, more than 90% were. How do you work with it if it's genetic? Well, you give them the methyl back with their vitamin B12. What? Vitamin? Yes, but methyl, methyl, methyl vitamin B12, not just any old B12.
Oh, not just a normal B12. Yeah.
Right. So when I did that with a patient, literally 70 years old, who had been told for 50 years she had fibromyalgia, when I first met her, she hobbled off the elevator, had a cane, took a while to get into the front door, shuffled, the whole bit. Well, when we discovered that that's what she had going on, and she had a few other things going on, we balanced her hormones, whatever. But one of the days she came into the office, the elevator door opened, and she danced out of the elevator, opened the front door, danced into the office, and my secretary just went, wow. Methyl B vitamins. Who knew, right? So sometimes really simple things can make a huge difference.
And like the normal medical industry probably doesn't want to hear that, because if they're prescribing a lot of other things and they've got pharmaceutical contracts or commissions or whatever they get from doing that, and they're being measured. So
it's
not going to go that way.
Therapy, occupational therapy, pain medication, chiropractor, you name it. They were doing everything when all it took was the right B vitamins, the methyl.
And that's not billable. That's not as billable as the other stuff.
Nope. But wow, did it work?
So that's a real big challenge, because a lot of people probably will get the top down from the doctor trying to hit the quota, so they don't lose the vacation time, and they don't lose the sick time, and they don't lose their bonus, and they don't get fired. And it's they don't know that. The patient doesn't know what the doctor's kind of how they're being guided. They're assuming that they're doing the Hippocratic Oath and they're doing no harm. And so that's a eye opening for a lot of people. They're oh wow, I need to take more ownership of my health and actually find people like yourself that actually start looking into it.
Right, exactly. So my website is down there displayed on the bottom. On my website, there is a books tab that you can actually go on and you can see these books. So if you have an adolescent, if you know a perimenopause, menopause, or postmenopausal woman, they need to know that they can take charge, and these books will help them. Again, a men's book is coming.
That's important. Yeah, I think my wife would be very interested in the one that applies to her. But my daughter, well, she's already 22, so she's kind of past that part. But
that first
she'd probably be interested too.
25.
Yeah. Yeah. 25, so she's still there. So both of them could check it out. Yeah. So that's really cool, because I think knowledge is power. And that's why we talk to people on the podcast, because we do these long form interviews so that we can kind of get into more than 15 seconds, 30 seconds, 9-second sound bites, which is what people tend to get today. And they just get, the top 10 this, top 15 this, and it's real quick hit. Sometimes you need to actually listen to something a little more in depth so you can actually start to think it out. And I think this has been a really good podcast for a learning, teaching moment, because you've got a lot of experience and you really relate a lot of good knowledge, a lot of good information that I think is indispensable.
Thank you. It's to me, it's intuitive, but this is not common knowledge amongst most people. So
yeah, it's very important. And so I'm very happy that you came on the podcast today, because to relay this information is really critical to a lot of people, being whole. Because a lot of times people are probably not feeling right, and they're not getting the right advice from the people they expect to be giving them right advice. So it's
right.
good to actually get this kind of information and get it out to the public. It's super important. And I really appreciate that you were on the show today. We've been live on Facebook, YouTube, and Twitch. And by tomorrow, we'll be on all the other major podcast platforms where you can listen or watch the show. And again, your link, drvictoriamondloch.com, that will be fully clickable on all the platforms we're on. And people will be able to click
Wonderful.
through right on that. So that I do encourage everybody to click the link of any guest that's on the show and really dive into it deeper than what we talked about here. But again, thank you for being on the show tonight.
My honor. Thank you for the invitation. My pleasure.
Have a good night.